Now, welcome back. And as South Africa continues to record an increase in COVID-19 positive cases, workplaces with physical person-to-person contact, inadequate ventilation and common eating areas and also shared working accommodations as well as travel have been identified by the World Health Organization as some of the places that are more likely to report COVID-19 outbreaks. But how possible is it for certain workplaces to actually mitigate and take measures to minimize contact between workers while still obligated to provide services to the public? So to talk to us more about this and how employers can actually develop and possibly also amend their health and safety policies in order to respond to this COVID-19 pandemic, we're joined by Ntombizone Feni, who's the Executive Director of Change Management at 21st Century. Ntombizone, thanks so much for being with us on Morning Live. Welcome to it.
Thank you. Good morning to you and your viewers, Sakina. Thanks for having me.
So, of course, we are living in, unprecedented times, living with this pandemic, and we've seen so many changes in and around the workplace in terms of just the policies that have had to be adopted, people working remotely where they can, in instances where it is service, business, contact, person to person. Unfortunately, people have to come in to the workplace. And this has, of course, brought about many, many complications for employers in terms of how to mitigate. But in terms of policies, how have we done? How have employers actually adapted to the current pandemic situation?
Wow. So firstly, I have to acknowledge that we're living in a very fast-paced evolution in the workplace. So as far as best practices concerned, we don't have that already, that precedence that's been set. So we are making rules as we go. And that calls for, firstly, leadership capability to be very strong, because regulations that govern how workplaces should be kept safe in terms of the Disaster Management Act and the Occupational Health and Safety regulations are the minimum. But over and above that, we've seen organizations try and employ what has become the trend, hybrid working models and policies to further implement the legislation or regulations to suit their own organizational context and culture. So the regulations exist and they're quite clear on what the minimum requirements are in the workplace, and policies need to extend on that. But over and above that, leadership needs to rise to the occasion.
So, as you say, hybrid working models have become commonplace. But how practical is it for employers to actually mitigate, minimize, and monitor some of these new COVID-19 policy regulations that are in place? Because if you think about it, for example, in a service environment where people come into contact with others as a rule, how do you mitigate then in your policies for such situations to combat the spread of COVID-19?
Yeah, so it's a very tricky balance because business has to continue. So from an employer's point of view, they have to keep the business running in a service-oriented environment because they need it to be sustainable to avoid retrenchment in the first place. So the business must continue, but how do you ensure that business continues in a safe environment? The regulations are very clear on the minimum requirements in terms of, let's take a restaurant, for example, there has to be certain distancing in how you set up the restaurant, the minimum number of, or the capacity that the restaurant can take, and the service workers themselves need to always be wearing masks, visors, constantly sanitized. And, there's also a reality behind that because there's majority of South Africans that commute on a daily basis take 2 to 3 taxis just to get to their place of work, where they can't avoid being shoulder to shoulder with someone in a taxi. So those are unfortunate consequences of certain people that are economically active. But I think employers can employ some creative ways to ensure that there's safety in the workplace so people can continue coming to work.
So let's just put out a hypothetical situation following up on the example that you just made of someone who has to come to work, has to take 2, 3, 4 taxis in order to get here. Can another person, for example, then refuse to work alongside that person because of fear of exposure?
Well, I think COVID is not extremely new at this point. So at level 5, alert level 5 last year in March, there was a lot of anxiety and fears around the spread of the disease, but we've learned to live with it. So we've learned that, through certain family gatherings, we've gone to or going to the shops to buy essentials. You can keep yourself safe by making sure that there's a safe distance of 1.5 to 2 meters from between you and the next person. So refusing to work with someone that commutes is dependent on how close you are to that person. So if there's the minimum requirements of the regulations are enforced in the workplace, you won't have to. If you keep wearing your mask and sanitize. So those are things that we would have to live with for a long time because vaccinations are quite, months and months away from everyone having that level of comfort where you can, be as flexible as you want in terms of your movements.
Ntombizone, also in terms of vaccinations, so obviously people have the right to refuse being vaccinated. How does that play out in the workplace? Can someone, for example, then again refuse to be in the same area with someone else who refuses to get vaccinated? Someone could, for example, perhaps say, I have comorbidities, and therefore, if you refuse to vaccinate, surely I have the right to protect myself. So can I, in that instance, refuse to work in the same space as you?
Yeah. So this is why I say the law can stipulate as much as it can to set boundaries to avoid the spread of the disease. And policies have to be clear guidelines that are set, and the operative word being guidelines. Over and above that, discretion has to come into play where management is concerned. And you also take employees from a case-by-case basis. We live in a country where, the nature of the workplace is quite diverse for organizations that have transformed anyway. So you need to also take into account the demographics of the employees that you have within your workplace and be flexible and agile in the leadership style to mitigate any risks or consequences of that nature. So I think there is no rule book at the moment. There's no best practice at the moment, which is why I'm saying leadership needs to tread in a space that's been coined as HECI, which stands for humanity, ethics, compassion, creativity, and innovation or imagination. So that's the level of leadership capability that's required to rise to the occasion where the law or policies cannot enforce how employees should behave.
And then, of course, there's the situation whereby in some instances, for example, if you are a part-time worker, if you're an independent contractor who basically gets paid rather for the number of hours you work or number of days that you work, people might be hesitant to actually disclose, even if they've tested COVID positive. And this, of course, because they may not necessarily present with any obvious symptoms. How do companies then mitigate for that? Because that could very well give rise to the sort of cluster outbreaks that we're trying to prevent.
Yeah. So companies are not God in the sense that if someone has symptoms but they are asymptomatic, so the symptoms are not visible, no one will know. So every citizen has the responsibility to not just safeguard themselves, but those around them. So I think the rules are there in terms of the regulations. If there's symptoms, you have to isolate. It's moved from 10 days to 7 days now. But where it affects your work, especially as an independent contractor, it would depend on how the contracts and policies that govern that space are also evolving with times to take into account that kind of environment. So in the workplace where you're permanent employees, there's leave policies, there's medical policies, etc. But with independent contractors, your SLAs that are signed between you and the organizations also have to evolve to take into account these uncertain times. You're lucky if you work for an employer as an independent contractor that's willing to negotiate or renegotiate the contract terms from that point of view.
And Ntombizone, as you say, this is such an interesting time, but also a very challenging time for employers from a policy perspective, because you also have the issues associated with long COVID. And again, where someone who has gone through the treatment comes back and may find themselves with these lingering effects of COVID. How, again, can employers best navigate that particular space if someone is perhaps suffering from fatigue, if someone for one or other of the lingering symptoms is incapable of performing optimally? How should the employer deal with that?
I think wellness has become a hot topic as well, to ensure that employees, not just the ones that have been infected with COVID, but the ones that have been affected with COVID, can navigate their mental space, their physical well-being. So some employers are enlisting the services of wellness services where you can contact someone. Others are, relooking at their medical aid schemes or benefits to cater for those kinds of effects, because they've been proven in a number of cases to be long-term. Also in a psychological level, fatigue level. So there's ways around it, which is why I'm saying there's no rule book. It's all about how, based on your leadership and organizational culture, as an employer, you're willing to go the extra mile to ensure that your workforce is comfortable and safe and productive.
And then, of course, it has been controversial since the very beginning, when people have had to perhaps quarantine, take time off because of COVID. The questions have always been asked, where do you take that time off from? For example, if you've been exposed especially, it's one thing if you, the person who actually tested positive, but someone who's just been exposed and you now have to take precautionary measures, the remuneration around that, for example, if you're not a permanent employee, and if you are, which part of the provision of leave should that be deducted from? Going back to all the considerations that you mentioned earlier.
Yeah. I mean, when we conducted a survey last year, there was no one common trend. Employers were doing whatever works within their own organization, but most of them were not deducting leave from sick leave, for example, because if you contract the virus or you're exposed more than once, you've exceeded your sick leave days very, very quickly. So it's about an arrangement, and also looking at the history of certain employees, because some might use that as an opportunity not to come into the office, for example. So you look at that from a case-by-case basis. And also, let's not forget past practices where if you are ill with any kind of illness or infected with any virus, you would be required to produce a medical certificate from a medical practitioner that says you cannot, if you've been absent for longer than 2 days, for example. So those rules shouldn't go out the window suddenly because of COVID. They can still be adhered to. And, the COVID hotline also exists, where if you are uncertain of what should I do now that I've been exposed, I need to get back to work to be economically active. The COVID hotline can advise employees on the next steps, whether to go to the nearest test or whether the symptoms are not prevalent enough for you to decide whether you've got COVID. So, like I say, there are no rule books. It's a time of extreme flexibility and making decisions on the fly, but also we have to try and be as sensitive as possible as employers and leaders.
We'll have to leave it there, but thank you so much for helping us navigate that, Ntombizone Feni, who's the Executive Director of Change Management at 21st Century. And it really is a very important subject, and at a very important time as well, when so many employers and employees alike try to navigate the workplace. And they're doing this, of course, with these unprecedented workplace experiences, Leanne. And of course, we are ourselves, finding ourselves in this particular situation where half the time you just don't know how to go about things.
Yeah, it's still very, very uncomfortable. I mean, you don't know. Yeah, it's just you come in every single day. I mean, we sort of in a very different environment to, say, a corporate where, it's still sitting in these spaces and workspaces on top of one another all day. But I mean, it is. I think things will change all over the world, but I think we just got to get through where we are at the moment, especially in Gauteng. We're seeing numbers rising, obviously around the country as well. But I think what's interesting to note as well is for, the Monday and Tuesday figures are always a lot less. Because these are reflecting from the weekend. So, once we hit Wednesday, Thursday, Friday, Saturday, then you again see it. And, it worries me. It really, really does. So, yeah, we're in a tough situation.
We are. And I think one of the things that perhaps, and I feel is something that's on the back burner is the psychosocial effects of COVID-19.
Yeah.
It's easy to deal with the physical symptoms and, all the more practical issues that go along with it. But when it comes to the intangibles, much more difficult to get a handle.
Yeah, it's huge. I mean, if you think of just from kids, from very, very young kids, and the different kinds of socialization that they are not used to being the way that we are. We're humans. We crave attention.
We're social
That's
beings.
what we want. That's what we need to do. And now suddenly, you're forced to be away from each other. I mean, I was having this conversation with somebody in a shop yesterday when I was buying something. I was literally speaking to her from the door to the to the counter, and it's just that social distancing, and everyone feels the same. You just want to run in and run out and get away from people. It's very, very tough. We thought we were out of it, but we seem to now be moving into the center of the storm, bigger than we've ever seen it before.
A new normal is what it is.
Yeah.
But that's where we have to leave it for today.